at Nanyang Technological University, Singapore, and member of Global Leaders Group on Antimicrobial Resistance, and Sunita Narain, Director General of the Center for Science and Environment, India, and member of the Global Leaders Group on Antimicrobial Resistance, for a conversation with Foreign Policy's Andrew Sollinger on the global fight against AMR.
The global fight against AMR. So I'm with two people who are ready for action also. And I thought that was a very interesting panel, very worthwhile discussion. And we're going to wrap it up here with two members of the AMR Global Leaders Group. Very pleased to have you both here. Ernst, Kuipers, Sunita, Narain, thank you for joining us.
Thank you, Andrew.
Maybe we could start off, let's just go to the top. Tell us about the Global Leaders Group. How do I apply? How do I get into this group? What do you do? What is the mission? And tell us a little bit about it.
Yeah. Wait, should I?
Yeah, please.
Please.
Okay. Please do.
So it was a group put together, and I can see other members of the group as well in the room. Group put together essentially to try and keep the conversation on AMR going. And somebody like me, I'm not normally part of such groups. I'm an environmentalist, and I'm a bit of a kick-ass environmentalist. So, you know, I was invited in because the issue of environment and the issue of agriculture, food-producing animals, was not understood as well. And so we were an interesting group, and led by Mia Mottley, the Prime Minister of Barbados. She's a force to reckon with.
She sure is.
And that was very good leadership, because it brought different communities. We had people from the industry, people, you know, Ernst was there from government, helping to show how government could move, how the Netherlands had done so much, and what could be the policy prescription. So it's a good group.
So we have a kick-ass environmentalist, self-described, but we also have, until very recently, health minister from the Netherlands, and a gastroenterologist. So a kick-ass gastroenterologist? Is that like redundant? I don't know.
Oh, that,
Sorry.
Who actually started his original research as a graduate student very long time ago in a lab inducing resistance in bacteria, because we needed multiple resistant in the lab.
Haven't you come full circle? Yeah.
So, I mean, if you look at it from a clinical perspective or a governmental perspective, usually what we do is we focus, and we rather focus on what we call large topic. And we heard them this afternoon also, like oncology or mental health or whatever. And then antimicrobial resistance for many people, also in clinical medicine, is like nitty-gritty. It's case history. But it's not. It's of huge importance. And just to give the numbers, so you know them well, latest report, WHO, very recently, the estimate is that at this time already, annually there are approximately 1.2 million people dying every year as a direct result of antimicrobial resistance, and indirectly another 5 million. And the estimate is that this will increase in the coming 2 decades with at least 70%, if not double.
Dame Emma just brought out a figure of 40 million people. I mean, we're talking real numbers here.
Real numbers.
So let's talk about mobilizing resources, fostering public-private partnerships, pushing for innovation. First, I wanted to talk a little bit about the importance of the One Health approach.
Yes.
Maybe, Sunita, you could tell us a little bit about that, what it is, why it matters.
So, you know, Andrew, that's really where the big question today is. We know that antimicrobials are necessary for human beings. They're miracle medicine. It's the silent pandemic that we keep talking about, that we are losing the power of those medicines, and we're not getting new ones on the table. And that's the whole question about antimicrobial and the challenge of it. Now, one of the other pathways why you have resistance growing is because of the huge quantum of antibiotics, antimicrobials, which is used in growing food, in producing animals that are used for food, and the waste that comes out of the environmental, the manufacturing sector, the hospitals, which is all adding to this sort of the bugs that are in the
And it's actually more than the antimicrobials that we use as humans.
Humans, absolutely. And so the threefold agenda for One Health, if I could just quickly wrap that up, is one, conservation. There is a group of antimicrobials that are critical for humans. We need to conserve it. Think about it like a biodiversity agenda. We need to conserve it. Now, we need to make sure that those are not used in animals. And that is part of the political declaration draft. There is wording on that. And I think that's very important recognition. Conserve that group. Don't use it for animals so that we can make sure that it is available for future generations. It's like a common resource. It's a trust that we have to the next generation. The second is the issue of prevention in animals, because, the fact, and I'm talking from my perspective, my country's perspective. I come from a country which can't afford to first pollute and clean up. And that's actually also your country's problem, but you won't recognize it. But but I certainly...
Have you walked around New York lately?
But certainly in our part of the world, we cannot afford to pollute and then clean up, which really means how do we prevent the use of antimicrobials in animals? And that's where the question of how we grow our animals. If you have intensive agriculture, highly stocked animals in unhygienic conditions, you have to use antibiotics. So the whole question then becomes animal, intensive food farming systems.
Yeah.
And the last question, and that's really the prevention agenda, is the more you look at clean water, food, the less you have to use antimicrobials.
So
that's the agenda.
Please.
Briefly add to that. So the One Health concept seems to be very new, but if you look at our ancestors for tens of thousands of years, they have very, very well known that they were an intricate part which was fully dependent on the full environment, not just the animals and the plants, but everything. So One Health is basically not a modern invention, but it's a very, very ancient invention. And
right.
Now this goes much further than just our animal husbandry and our livestock and our agriculture. If I just can give one example, we have very good evidence now from different parts of the world, China, Europe, the North America, that, for instance, the increase in our ambient temperatures as a result of climate change actually by itself already increases antimicrobial resistance. The estimates are like 1 degree increase leads to a 14% extra antimicrobial resistance, just as one. Now, also the fact that antimicrobials are basically everywhere, in your soil, in your surface water, etc., is a good example of that. And with that, and also with all the other effects of climate change, it's really a full circle.
Right. You referenced, Sunita, earlier, the political document that has come out. Maybe we could talk a little bit about that. What was in that political document?
So, from my perspective...
And what wasn't in it?
Yeah, from my perspective, and it's really about... So, we wanted more. And but I think it's the political document... You know the UN system, it's all about consensus and the lowest common denominator and, all the rest of it. But so 2 major issues were there that the GLG had asked for. 3 issues. We wanted the world to set targets, firstly, because targets are important ways of holding governments accountable. So the first target, which is in the political document, is about a 10% reduction in mortality from AMR by 2030. That's in the document. Now, that can be quantified. It can be used to look at where governments stand, what can be done more. How do you fund the government so that their national action plans can happen? But the other 2 targets, which were targets, so there was a target on critically important antimicrobials should not be used in animals. That is now this, UNE's watered down.
Unis, that's a language.
Watered down sort of, it's there. So if you scratch and you look, and somebody like me, it's there. But it doesn't add up to saying, do it, which is what I would have liked to see. And the third is that we had asked for a 30 to 50% reduction in the use of antimicrobials in the food and the agriculture system. So a tough target, okay? It's there, but it's turned into a language that says meaningful reduction. So I can live with it because I have to, but I obviously would like to see much more happening, because at the end, Andrew, and I'll leave, the last point is, this is not just about AMR, this is also about climate change.
Yeah.
Because remember, agriculture is the core of the climate change crisis. And so if you're talking about biodiversity, you're talking about climate change, you're talking about AMR, they actually come together from the perspective of the food we eat and how we grow it.
I can add to that.
Please,
because a report is one thing, and I think the importance of a report, even if the wording is not optimal, is that it puts it on the agenda and at the forefront again and again. And that's what we do. And we have to do that also together, and also realize that many of the individual topics can actually be achieved by creating awareness and taking action at any individual level. If I just give you the examples of what we achieved in the Netherlands, we heard about a lot of use in animal, in husbandry, livestock. So with continuous measures over a decade, we achieved an 80% reduction of antimicrobial use in our farms without any effect on the economics of the farm. So the traditional story which you will hear is, oh, this cannot be done, and otherwise it can be done. And actually, the farmers will not lose money, but they gain money. They don't have to spend it on, etc. So there was one thing. If I just look at humans, for instance, here in the US, I learned again last week, if you look at antimicrobial use and exposure to antimicrobials during pregnancy and for newborns, for neonates, we know already that if they are not very, very targeted, they actually do a lot of harm. There is a lot of evidence nowadays that use of antimicrobials in newborns may significantly increase the risk for a whole range of conditions, including obesity, which is a modern disease. Now, in the Netherlands, the use of antimicrobials with very strict guidelines during pregnancy is nowadays 20%. 20% of the women receive antimicrobials during pregnancy. Here in the US, it's approximately 70%, 70. So I dare to pose the statement that a marked proportion of that additional 50% is actually doing harm and no good. So once we know that, and it's just not for saying this is what the Netherlands do, no, we can share. There are many other ways where other countries are doing very well.
So let's dig into that a little bit.
Yeah.
Increasingly, countries are issuing national plans on AMR.
Yeah.
What can we do to ensure that that's happening across countries, and how can we popularize that
so we can,
and help with that implementation and share learnings?
Yeah. So for one, I mean, on a clinical level, but also on farming and in agriculture, etc., there are many, many connections, not just on a governmental level, but also for long. I've been a member of, for instance, here an American Gastroenterology Association. This is what people do. Like you meet and you exchange and you develop international guidelines, not just in medicine, but in other areas as well. You can monitor that. You can follow up on that. You can also, as a government, stimulate that. Another one is a discussion, and we had the same in the Global Leaders Group, is look, and we heard the discussion here already, our models, like for antimicrobials, is like for many other things, are based on payment for use. But what we want to do here is actually pay for the innovation and then not use it. Well, that sounds like a strange model, but if you think of it, there are many things in life where you pay for preventing and not using it. Your fire extinguisher at home. In the Netherlands, we pay a lot for our waterworks, and they are based on the potential risk which might occur once every 10,000 years. And we happily pay for it and maintain it. So the discussion was we need similar payment systems for antimicrobials.
Sunita.
So you at the earlier panel were desperately looking for a good news story.
Yeah.
I want to end with one.
Could we do that? That
Yeah.
would be great.
So I want to end with that. So in India, we have a huge dairy industry. I mean, we are the world's largest milk producer, but we produce it very interestingly from smallholder cattle owners. So 1 cattle, 2 cattle, 3 cattle. We have this very large cooperative system called the mother dairy. And they became very conscious of the fact that they needed to control the use of antimicrobials.
The mother dairy.
Okay, the mother dairy. It's called the mother dairy, which is this large confederation. And very interestingly, and this is where it's about the prevention, they really went back to what is called ethnomedicine. So medicine that, would be produced in the home almost, the grandmother's recipes for medicines, made at home. But the trick of it is to get farmers to understand, to catch the disease before it actually happens, and to be able to give that medicine, and also to make sure that they understand that you can do so much to prevent the disease from happening. And as a result of it, they have seen the use of antibiotics across this massive milk-producing system they have to come down to less than 20% of what they were using. And the most interesting part of it is, and that's what, at the end of the day, it has to come home to you. You have to do this. And in this case, the farmers did it, interestingly, for something that you and I would never we would do antibiotics, reduce it, it's bad for humanity. And the reason they did it is because when they used to give antibiotics to their cows, they didn't produce milk, which would make good yogurt. And in India, yogurt is used more than even milk. And it's a very simple thing. It kills the bacteria.
Yeah.
Yogurt is about bacteria.
Bacteria in it.
Okay? So they actually took to this, one, because it reduced the cost of buying antibiotics, two, because they saw something that they got which was good. So I think for all of us, the story is really how do you bring it home so that it works for us and we understand that it's in our power to actually make the difference.
That is a good news story. Thank you for sharing that. I like that one very much. We're over time right now. But I just wanted to say I don't think I could be a Global Leaders Group member, and I don't know who's doing the picking, but they're choosing very nicely.
We propose you to become one.
I would say that another good news story is that we're very grateful that the two of you are serving on our behalfs, because that made a lot of sense, and I'm really encouraged by it. Our global leaders, thank you so much on AMR.
Thank you.
I'm sorry for being over time.
No, you were great. You were great. That was great. Wonderful. We'll see you in a minute. We're wrapping up.